Are you a mother, father, or you are involved in caring for children? If yes, then listen to Ask the Pediatricians every Thursday by 10 a.m. for insightful discussion on popular child health topics such as dangerous child health practices, immunization, infant feeding, developmental milestones, and so much more. You also get to ask questions on these topics and listen to answers to real-life child health issues by a pediatrician. Ask the Pediatricians Foundation is devoted to health education and information of parents and caregivers of children in the community to support you in raising healthy children. Don't miss Ask the Pediatricians with Dr. Gani because it's informative, educative, and interactive. Ask the Pediatricians Hour, the program for caring parents. Are you a mother, father, or you are involved in caring for children? If yes, then listen to Ask the Pediatricians every Thursday by 10 a.m. for insightful discussion on popular child health topics such as dangerous child health practices, immunization, infant feeding, developmental milestones, and so much more. You also get to ask questions on these topics and listen to answers to real-life child health issues by a pediatrician. Ask the Pediatricians Foundation is devoted to health education and information of parents and caregivers of children in the community to support you in raising healthy children. Don't miss Ask the Pediatricians with Dr. Gani because it's informative, educative, and interactive. Ask the Pediatricians Hour, the program for caring parents.
Good morning, everyone. Good afternoon, good evening, whatever time of the day that you're watching this program. I want to say a warm welcome to Ask the Pediatrician Hour. Ask the Pediatrician Hour is a program where we get to discuss important topics about the health of our children. This program is brought to you by Ask the Pediatricians Foundation. Our mission is to see that no child dies from preventable causes of death. And we do that through health education, information, online, offline, through our community medical outreaches. So welcome to today's episode. Whether you are watching me on Ask the Pediatricians Facebook group or the pages or our YouTube channel, I want to say thank you for joining us today. I also want to thank those who are watching on our YouTube channel. I want to say thank you. For those who are listening on Fresh Waves Radio or Ask Dr. Bemi ATP podcast, you're also welcome to today's episode. If you are just joining us for the very first time, we say thank you so much for joining us. And you know that you can watch all the past episodes of all the various topics we have been discussing about the health of our children. You can watch them or listen to them on our YouTube channel or the podcast or our Facebook pages as well. So thank you so much for those of you who have been joining us, and for those who are joining today, you are very much welcome. As our usual practice, we'll be discussing an important topic. Today we're going to be talking about sepsis. All right, this topic I decided to discuss is on request of one parent who wants us to talk about this topic. So we're going to be talking about sepsis today, and it is very, very important, as we're going to see later on why it's so important for us to know about sepsis. I know many of us, we are used to doctors using that jargon a lot. A lot of us, sometimes when we go to the hospital and you ask your doctor what is wrong, and they will make mention of the word sepsis. For example, in newborn, they may say neonatal sepsis, while for the other children, they tend to use the word sepsis a lot. But what does this sepsis mean, and how does it impact on the health of our children? So we're going to look at what sepsis is. We are going to look at what are the signs or symptoms for parents, for a child who is having sepsis. We're going to look at how do doctors make those diagnoses, and then how do we treat it in particular. And more importantly, for parents, I think you really want to know how we can prevent sepsis. So that is what we're going to be talking about today. All right. So when we talk about sepsis, you can also use the word infection, loosely for it. But sepsis is a little bit more than infection. So what happens in sepsis or infection is a germ, all these germs that can cause diseases or illnesses has entered into the blood or into the body of the child. And as a result, the body immune system is fighting and trying to um, get rid of this particular infection or this particular germ. And in the process, uh, a lot of things goes on that the body is trying to deal with, and that response of the immune system, which sometimes can go out of control, is what leads to this syndrome or this scenario that we refer to as sepsis. So in sepsis, it is when the body responds to an already present infection, that is presence of germs in the blood, in the body, gets out of hand, and it leads to a lot of what we call inflammation and all that. So, and this can lead to damage to organs. It can even lead to what we call organ failure. Some of the organs, like the kidneys, the heart, some of the organs begin to stop functioning, and that is when we call sepsis. And sometimes we tend to also use the word septic shock when the body starts to shut down, and sometimes this can lead to death. So when we talk about sepsis, it's actually a very serious condition. It is actually a little bit more than just a child whose full blood counts, which is what most of the time when you go to hospital, they do full blood counts, they do malaria parasite, and when the WBC white blood cells are high, then we say, oh, the child may likely have infection, and sometimes we use the word sepsis, but sepsis is actually a little bit more than just high white blood cells or just infection. This is more of a serious condition, and it is dangerous. This is a very serious infection with the immune system responding in a way that is going out of control, that is leading to damage to organs, that may even be leading to the organs shutting down. So we're talking of a very serious illness here, and it is something that can happen at any age. It can affect newborns, it can affect adults as well. But today, of course, we are going to focus on sepsis in children, since we are discussing the as pediatric cases as a pediatrician. So it is sepsis can occur at any age, but it's especially more dangerous in children, because sometimes it's very difficult for us as doctors, even pediatricians, to diagnose sepsis. Sometimes it is a little, if we are not very careful, we may not pick it up on time. And I've seen sometimes parents think, oh, my child just had a little fever, and sometimes the outcome is not good, and they just wonder, how can the child just having what look like small fever or small diarrhea, or end up dying so quickly. Sometimes some of the children are not just having so-called small fever, they are actually having sepsis. The infection is really more serious, and it has gone to that stage where the child organs are failing, and that is what is leading to organ failure and leading to death in some cases. And so it is very important for us to understand that sepsis can start from something as simple as a small injury, like a small infection in the hand. Sometimes I see parents who post pictures of their children having like little boils here and there, and they don't see it as anything big deal. They don't see it as something that they really need to like take to the hospital. And sometimes we see these boils around the face, I know what we call the dangerous area of the face, because those areas, the blood vessels from there go straight to the brain. And we know that if they are not quickly managed, those infections can spread quickly, get into the blood, get into the brain, and then the child can go into sepsis. So sometimes when you see us like asking that any little illness, please go to the hospital, please get it treated, is because we don't want it to develop into a more serious situation that we call sepsis. Because sepsis can start from something as simple as just infection on the finger or on the arm, or and it can also occur on top of another illness. Maybe the child already has another infection, let's say it's appendicitis, and if it's not treated on time, it's ruptured, then it spread uh, all over into the blood, and then the child can develop into sepsis, and that can lead to more catastrophic outcome. And that is why it's so important that we don't take uh, illnesses, infections in children lightly, that we take it very seriously, and that we do the right thing. So the main challenge here is that it's sometimes difficult for us to know when children are going into this more serious stage. And that is why at the beginning, when things are not so serious, that is the actual time to seek help. That is it. And one of the main challenge we always have, especially for those living in Nigeria in or so-called third world countries, is this late presentation to the hospital, because most of the time people want to do self-medication. And I always tell mothers, yes, we agree with you. You are the first doctor in the house and we appreciate all you do, but we must learn to know when to drop our doctor's hats. We must learn when to let the real professionals take over. Sometimes if we don't do it on time, then we're going to put the children at risk of sepsis. So we've explained what sepsis is, and now we're talking about who's at risk of sepsis. Any child, really, anyone can develop sepsis, anyone, but there are some children that are more at risk of sepsis than others. Our very small babies, especially if they are born premature, they are very susceptible. And that's why I tell mothers, for the newborn babies, there is nothing like any small illness in them. There's nothing like I would self-medicate them. Please don't. Even if it's as small as a child refusing to suck, they may not even have fever, they may just be, not active and all that. Sometimes we just have to take them to hospital. We classify those children less than 2 months as children that are high risk, because we know that they can easily develop sepsis and infection. So these are children at risk because their immune system is not yet fully mature. The immune system is developing. And so newborn babies, preterm babies, they are very high risk. And usually we refer to the kind of sepsis we have in the newborn as neonatal sepsis. So it is something that can happen. And even though we say neonatal sepsis, we still take it even up to the 90 days of life, so up to 3 months. So if you notice any symptom in these babies, please do not do self-medication. These are children that you should take to hospital. And some of them can have infection from bacteria from the mothers. It doesn't disturb the mother, but the father, these babies, their immune system is still developing. Those infection can affect them more seriously. Also, children that have stayed in hospital for long. This is why sometimes when you go to the hospital, we don't want children staying there for long. We want to treat them quickly and get them out. And we don't like children visiting hospitals. Some of you like to visit friends and you want to go in with your babies, and we see doctors, nurses say, please don't, because when children come into the hospital, there are some infections that live in the hospital. We call them nosocomial infections. The bacteria, the germs, they are always there. And people that stay long in the hospital are at risk of catching this infection. And we don't want people who have no business being in the hospital coming into the hospital and also getting exposed. So please, when you want to go visit neighbors, friends, family in the hospitals, please don't take children with you, because you don't want them to go gets them exposed to this infection. Also, children who have some, materials in the body. Maybe for one reason or the other, we have to put in catheters. Maybe they have some malformation, and maybe they cannot pass through the right place, and they need to put in something we call colostomy, or they cannot pass urine through the right place. They need to put in urinary catheter. Anything that requires us putting tubes or anything into the child's body, these devices also predispose those children to risk of sepsis. So even children who already have infection that are minor infection and they now need to stay longer in the hospital, then they can also go ahead and develop sepsis. So generally anybody is at risk, but those group of children, the newborns, the preterm babies, children who are staying longer in the hospital, children who already have certain infections and maybe it became worse, or children who have devices in their body, these are children who are at risk of sepsis. And those are the ones that we really need to be very aggressive about. To make sure they don't develop sepsis. Now, what are the symptoms and the signs of sepsis? Like we said earlier, one of the things that makes sepsis dangerous is the fact that it can happen so quickly and it may not be, very, very obvious. And so it is very easy for people to mix it, and especially in places where people don't take their time to really do proper evaluation of children. And children can be mixed even though they have sepsis, and then this can be very, very dangerous. So we always have to be very aggressive, especially for the doctors. And for the parents, our whole role is to make sure that we go to the hospital on time. But for the doctors, we need to be alert when children are sick, that we don't just treat every fever as malaria, or everything is not malaria and typhoid, which is the only true diagnosis on hospital streets in Nigeria. No, and everything is not fever and sepsis as well, because the white blood cells are high. There are other signs that we really need to look out for in children with sepsis that will make us to know that this is a very serious thing and we need to deal with it very fast. So what are the symptoms? Fever. Fever is a very common thing. Unfortunately, many people always assume fever is malaria. Fever is not malaria. It is not, every fever is not malaria. We really need to get rid of that thought that every fever is malaria. No, every fever is not malaria. And so if a child is having symptoms of fever, it's good that we go to the hospital so that the child can be properly tested and then we know what is wrong. We don't just assume this child has malaria. So fever is still it's one of those signs or symptoms of sepsis. Also, we notice that the children are just lethargic, or they are just being too weak, or a lot of mothers do ask those questions. You will say, oh, the child is just sleeping more than normal. And I see those questions. Most time people that are asking those questions, they don't even see it as something serious. For us, it's a very serious sign when your child is not as active as before, or they are sleeping too much. A child who is not eating well, who is having fever, who is sleeping more than normal, that could be a child who is having sepsis. So this is not a time for you to see some of the symptoms. I agree that they sometimes overlap with what we normally see even in malaria, which is the danger here, because people just assume it's malaria and they don't address it properly, which is the danger of just assuming malaria and treating, because the symptoms or the signs of sepsis can look like a child who is just having malaria, which is what most parents adopt, but this is really dangerous. So if your child is having fever, they are looking lethargic, they are looking tired, they are sleeping more than before, they are having nausea, they are vomiting, they are dizzy, they are not themselves. These are, symptoms that you can see in virtually any illness as well. So the thing is, let's go to the hospital. When a child is sick, let's avoid doing self-medication. Let's avoid saying, oh, it is malaria. No, there are many hundreds of conditions that can make a child to have fever. And sometimes in children, that is the only thing we're going to get. It is going to still be the same fever, no eating, vomiting, tiredness, sleeping too much. It's still going to be those same symptoms we are going to see in them, which is what we're going to see in malaria, which is what we're going to see in sepsis. So it is difficult to know which one is which is the reason why we have to take them to the hospital and let the doctors see the children. Because when doctors see the children, we can do other things like check for their heart rate, check for their respiratory rate. So usually for children with sepsis, we notice that they have what we call a fast heart rate or tachycardia. Their breathing may also be fast as well. Their level of consciousness may be dropping. So there are other signs that a doctor will pick up, which a mother or a father will not be able to pick up. And when we put that into the picture, then we will know that, oh, this is not just ordinary simple malaria. This is a child who may be having serious infection or sepsis. And then usually there are things doctors will do to confirm that. Usually we're going to do some blood tests and all that, then we will know. And then we will start doing the treatments. And the thing with children when it comes to sepsis is time. Time is key. The earlier, the better. You know, if we don't start treating it on time, then the child can go into the phase of what we call septic shock. Then they can go into the phase, where we have what we call organ failure or organ, dysfunction, and then that is very close to death. So this is why it's so important for us to, if there's anything we're going to take away home from here today, is that let's go to hospital on time when children are sick and avoid doing self-medication. No, so when you go to the hospital, how does the doctors, how do they make the diagnosis of sepsis? So there are not one single test alone. There are many tests that doctors will do. Of course, we usually do the full blood counts. So full blood counts, it will tell us the level of the white blood cells, and it usually is very high in children that have infection, and so it can also be very low, especially for those who have low immunity. So the extreme are both what we worry about. There are also other tests that doctors do, like what we call CRP, C-reactive protein, lactic acid, and all that. I'm not going to bother us with all those jargons, but there are other tests. Sometimes we also take blood for blood culture. We take urine for urine test, urine culture, and all that. Everything is not just malaria and full blood counts. We need to do all these other tests if we are worried that a child may have sepsis. And once we take the blood, we don't wait for the results to come out before we start treating a child who has sepsis. Usually, those children are admitted to the hospital. And there are some conditions that children have to be managed in the hospital. Sepsis is one of them. We're not going to send that child home. The child has to be admitted in the hospital. Usually, the doctors will put up what we call intravenous line, or puts a catheter in the blood vessel where they can pass the drip and pass antibiotics and all that. So usually we start treating the child even before we see the results of the test. So we start giving the fluids, we start treating with antibiotics. If the child is becoming unconscious or going into shock, we may have to take the child into the intensive care unit. And we have the specialists, pediatricians, intensivists, and everybody. We are there monitoring the child closely because we have to get it right. So there are some drugs we start with before we know what it is that we're dealing with. Then when the results start to come out and we have an idea of what kind of infection we're dealing with and all that, then we can modify our antibiotics. We do a lot of supportive treatment. Usually this treatment is not for parents, it's actually for the doctors to do, so I won't go into the details of that. But the most important thing is that the doctors start the treatment on time and they are very, very aggressive with the treatment. So that is how sepsis is managed. Sometimes children may be in the hospital for days or weeks, depending on how severe it is. And hopefully we are able to also support the body system to calm down that excessive reaction to the infection, and get the infection as well under control. So that is how sepsis is managed. So for those of you who may just be joining us, we've been talking about sepsis. We've talked about the sepsis being a situation where the body immune system is reacting in an excessive way, out of control way, to infection going on within the blood. All right. And this excessive reaction leads to organ damage, and it leads to fatal consequences if not properly managed. And we've talked about the fact that anybody is at risk of sepsis, but children especially, and especially our newborn, our preteens, or children who already have pre-existing conditions or infections as well. And then we talk about the fact that it is very difficult to diagnose a child who has sepsis. It is high index of suspicion, and some of the symptoms are symptoms we are going to see in most of all the infections or other illnesses that children are going to have anyway. So it's still going to be the fever, it's going to be the nausea, vomiting, they are sleeping too much, they are not active, or they are, all those symptoms that we usually see anyway. But when we see a sick child, the key thing to managing sepsis and making sure that we're able to overcome it is early presentation in the hospital. So when the child is sick, the doctor see the child, they examine the child. There are other signs doctors can pick up, like tachycardia, like fast breathing, like fast heart rates, all that, and then they can take the necessary blood samples, urine samples, blood culture, and then send those to the lab and start treating the child immediately. Usually, children with sepsis are managed within the hospital with intravenous fluid, intravenous antibiotics, and hopefully we're able to overcome. Sometimes if the organs are shutting down, we may support the organs that are shutting down. For example, if the kidneys is failing, we will need to support. We need many other doctors, specialists coming in and doing their part. Hopefully we don't hope to get to that point, but sometimes we get to the point of what we call septic shock, and we need to do all this support in place. So that is what sepsis is all about. Now, the most important thing I think is, how do we prevent sepsis? Just like what we normally say, prevention is always better than cure. It's not just that it's better, it's cheaper, it's easier for everyone. So we always like to talk about prevention and not just about diagnosis and treatment alone. So the most important thing is the same principles of prevention of infection generally. It's the same principle here also when it comes to sepsis. I think one of the things most of us have learned during the COVID pandemic is this concept of prevention of infection through hand washing, social distancing, and another. And those principles still applies when it comes to sepsis as well. It's still hand washing, and this hand washing is not just for the parents, okay? Even the children, we need to let them wash their hands. Children play a lot, they touch surfaces, they touch everything, and some of them, very young ones, in that phase, what we call the oral phase, anything they put their hands in their mouth, they put it in their eyes, and these are the gateway through which these germs can enter into the body. So we need to make sure we're keeping the environment around the children very clean. We need to make sure we wash their hands, we clean the surfaces where they are playing with around. We also take, like, if some of them are dummies or other toys that are playing with, they are putting it in their mouth, we wash, we sterilize them if possible. So we just need to make sure we prevent as much as possible the introduction of the germs into the body. That is the first thing that we want to do. We don't even want the germs to enter into the body at all. And that is what we do through hand washing, through general hygiene, cleanliness, and all that. We need some parents, believe that it's okay for children to play with sand, put it in their mouth, hit it, because that way they expose them to germs and they are going to develop immunity. Sorry, you don't need to expose children to dirty surfaces and things like that to make them develop immunity. There are lots of germs and bacteria that you are not even seeing anyway, and that children are even exposed to through the hair and all that. So we don't have to deliberately expose children to all these germs because we want them to develop immunity. Please don't, let's not do that. We have a better way of protecting children, of supporting their immunity, which I'm going to go to next, rather than deliberately introducing them to germs. So please wash your children's hands, wash the toys, maintain general hygiene, boil water. If you're not sure of the source of your drinking water, food should be properly cooked, covered, no flies. So we just need to maintain this general hygiene around our children, and that alone will prevent lots of infections. In fact, just hand washing alone has been demonstrated to prevent several, incidences of infection. So we should not forget it. Even though now the pandemic is over, we should still remember the frequent hand washing, or at least use your hand sanitizer as well. But another thing that's very important when it comes to prevention of infections, sepsis, is vaccine. Okay, immunization is very important. For those of you who watch our program on Monday, the doctors that was with me, Dr. Rotimi, reminded us again about childhood immunization, how it is so important for us to make sure that we take our children for immunization. So vaccines is our controlled way of protecting our children against infection. So in vaccines, we are introducing the children to the germs in a controlled version. We have killed the germs, or we have modified the product of these germs in a way that when the children are exposed to them, they don't have the infection, they don't have the germ multiplying, but the body produces the immunity or the immune response that will protect them. So that is a better way of getting children to develop immunity rather than exposing them to the real germs, which is what some people think they should do. No, we don't do it that way. The way we do it is through vaccine. And so we have lots of vaccines that protect children against bacterial infections. So we have the Penta vaccine, for example, protects about 3 or 4 of them. So it protects against diphtheria, pertussis, tetanus, protects against Haemophilus influenza type B, and hepatitis B. We have the pneumococcal vaccine, which protects against about 13 different serotypes of the strep pneumonia bacteria. Okay, so we have all these vaccines that protect our children, including other vaccine like measles, MMR, chickenpox vaccine, yellow fever, the meningococcal type A bacteria, which tends to cause meningitis. We also have a vaccine against this, which is given at 9 months. So when we give our children all these vaccines, we are protecting them against infections caused by these particular germs, and by implication, we're protecting them against sepsis. So immunization is the controlled way of protecting the children against sepsis. So please, if your children have not been immunized, it's never too late. You can go for them. I know some of you say, oh, I forgot, I missed it. But yes, we don't want you to miss it. But if you have missed it, you can always go. Even now that you've remembered, and now that I'm talking and you know that some vaccines that your children should have taken, at least according to the National Program on Immunization, you've not taken them, don't worry. Just go to the hospital as soon as you can, and they will give your children those vaccines, and they can still be protected. We call that catch-up immunization, so your children can still catch up on their immunization. Now, finally, how to prevent sepsis is act quickly. All right, I think I've emphasized that, but it is something that we cannot overemphasize. All right, act quickly. This is one thing that we struggle with a lot, especially in Nigeria. We don't act quickly enough. I see a lot of text posts, inbox messages people send to me, and we do get a lot of questions on our Facebook group. And people will ask, "Oh, my child was ill. I went to the hospital," and then they want me to explain why did their child die and all that. Of course, usually at that time, it is a grieving parent, so it's not a time to try and be justifying or casting blame here and there. But one of the things we shall find out is the fact that sometimes we tend to trivialize symptoms in our children. We tend to feel, oh, it's just teething, all right. And I've told mothers, please just remove that teething diagnosis from your list of diagnoses. There's teething does not make a child to be sick. I can't tell you how many times I've treated children, and we are battling to save the life of these children, and you ask parents, as we normally ask you when we're taking our history, how long has this child been sick? And then you are hearing like 2 weeks, and I'm like, where have you been? Why have you not come to the hospital until last minute? And they're like, oh, they told me it's just teething. They told me it's teething, and I've been giving teething powder. So then by the time they come, pediatricians, we can only try. We only try our best, but it's God that heals. It is God that can make alive. So we can't always sometimes win. But you can help us a lot by coming to the hospital on time. So please don't assume teething in a child who is sick. Another thing people always assume is this malaria. Everything is not malaria. I know we live in a country where malaria is our number one diagnosis for everything. We are living in what we call Olo endemic region for malaria. We know that we have malaria all year round, so it is not like it is there with us. It's endemic. It's not like something like epidemic that happens and goes away. It's always part and parcel, and most of us don't even see it as a big deal. So we have malaria, but we still go to work, and so it's not a big deal anymore. But the challenge with that is that we tend to make diagnosis of malaria for everything. In fact, people used to think when you say fever, you meant malaria. I've tried to correct that notion several times. Fever just means that the child's body is hot. It doesn't mean the child has malaria. There are many reasons why a child's body can be hot, and one of those reasons is sepsis, and it is not always malaria. So please, then let's avoid self diagnosis, especially in children. So children who are sick, please, we have to take them to the hospital on time. I see a lot of questions and they break my heart because I see a child who is very ill, who is having fever, very high fever, and the mom is telling me the child is having fever. Sometimes they put picture, the child is having lots of boils here and there, and this child has been sick for 3, 4, 5 days, and I'm getting all this information. I'm just like, why are you writing all this and you've not gone to the hospital? Like, what do you want us to do now? Because a lot of parents just think I can just come and ask on ATP 3, 4, 5 days. I'm like, what are you waiting for to happen before you decide that this child needs to go to the hospital? So please, let's not do that. All right. If your child is sick, day 1, day 2, please go to the hospital. You will notice that most of the adverts they give to us about paracetamol, they will tell you if after 2 days your child is not better, take the child to the doctor. There's a reason why they put that caveat, because a lot of us will just keep giving paracetamol. Day 1, the fever is still there, you're still giving paracetamol. Day 2, even the adverts already told you that after day 2, you must take that child to the hospital, because you're not just supposed to just keep giving paracetamol for fever for 2, 3 days. After 2 days, you're supposed to go to the hospital. So to avoid a child developing sepsis, we need to act quickly. All right. The chances that a child is going to survive, is going to recover, or the child is not going to develop the severe, complicated kind of sepsis is acting quickly. So I deliberately took time to emphasize that, because that is the most important thing. In addition to prevention, the first thing is to prevent it. avoid the infections, take immunization. But once the child is already sick, then we can no longer the next best thing we can do is to take the child to the hospital quickly. Okay, we take the child to the hospital quickly, and then the child can get the right treatment. Also, please, when the child is having those kind of illness, don't take them to health centers. There are some kind of things we don't take to health centers. Health centers is for you go for your immunization, go, family planning, preventive kind of healthcare, promotion kind of healthcare. That is what the health center is for. All right, you check your weight, check height, make sure the child is immunized and all that. When the child is very ill, please take the child to a hospital with specialists like pediatricians. So the minimum of that is a secondary care level hospital. For those in Nigeria, that will be a general hospital or a tertiary level hospital. For those in Nigeria or most places in Africa, that would be a federal medical center or a teaching hospital. So we really need to take our child to the right kind of people, because sometimes when we take some of the children to some of these low level of care centers, they waste another set of time, waste time doing full blocker and another. Then they don't know what to treat, or they just treat the child with just injection, and not because they are not had. They usually don't have specialists at that level of care, and that's also delay, because I've seen those kind of delay. And by the time the child is coming to us at the tertiary level, we are battling to save the child. So the earlier the child goes to the right specialist, the better. So act quickly, don't self-medicate, don't self-diagnose, go to the right hospital, the right specialist. And it's really, if you live in an area where you're not sure of the kind of private hospitals, I'd rather just say go to the government hospital, because some private hospitals also don't have the right kind of professionals, but they would like to keep you so that they can make the money they need to make, because they're a profit-making organization, whereas the government hospital is not profit. So they are just to make sure that the child gets better. But if you have a very good private hospital that have specialists, why not? You can take your child there. Now, the question is, can children recover fully from sepsis? The answer is yes. Children can recover from sepsis, but the earlier, the better. The earlier, the better. So there's a greater chance that the child will make a full and a complete total recovery if we pick it up on time before much of the organ systems have been damaged. But if we don't pick it up on time, there may be complications. For example, if the sepsis spread should affect the brain, and there's some meningitis or encephalitis, that is infection within the brain tissue, the child will recover, but the child may develop complications that has to do with the fact that the brain has suffered some injury, some kidney injury as well. Most of the time they recover, but sometimes it may not be total. So it depends on how quickly we start the treatments, and how far along the sepsis has progressed before we start the treatment. But if we're able to get it started right on time and very aggressively, we are able to save the child, and they're able to recover without any form of complications and all that. So that is sepsis we've been talking about today, and I hope we have learned one thing or the other. And I know a lot of doctors we use sepsis quite. They just say, "Oh, the food blocker is showing sepsis," and all that kind of terms that they use that loosely, But the real sepsis is what I've just described to us. It's a very, very serious illness. It's one of the causes of death of children, even in countries like the United States, where they have advanced, medical facilities where every child has their own pediatrician and all that. So even in those places like UK, US, most of the children that are going to die, one of the, it's really those who come to the hospital, it is actually sepsis that can kill them. So you can imagine that. So sepsis is something that is very serious. And unfortunately, 8% of it will be mixed because, like I said, the symptoms are just very similar to symptoms of children having any other illness, but sepsis is more serious. Most children with sepsis are likely going to stay in the hospital for a month. It's a very serious thing. And like I already said, preterm babies who are already immunocompromised, they are likely going to stay longer in the hospital compared to they are likely going to have sepsis much more. They are more at risk of sepsis than other children. All right, so that is what we've been talking about. If you have any question about sepsis or about any other topics that we've talked about on this platform, feel free to go to our Facebook group, Ask the Pediatricians Facebook group. You can ask your questions from Mondays to Saturdays. You just post the questions on our group, and one of our professionals we approve it, and then we will try and provide an answer to it as soon as we can. And hopefully, I hope to see come back one of these days for us to take a question, for us to do some question and answer session on some of these topics that we've talked about, or we can actually take a live question and answer. So hopefully we'll get to do that as well. I was hoping to see whether I can take a couple of questions that people have asked on this particular topic, since we still have a couple of minutes before we go to there. So let's just take a few questions and then we will round it off from there. All right. Okay. I'm just trying to get the questions on the screen, but I can't seem to get it right now. Okay. Right. So I have a question here. Somebody says, "Thank you, my wonderful doctor. Since sepsis is the multiplication of germs, is there anything that can be done to stop it reoccurring?" All right. Okay. Yeah, this is a very important question. People do has mothers do ask these questions a lot because people have gone into the hospital whose children have had sepsis and they are so, traumatized by that experience, and the question is this something that I can prevent from happening again? Sepsis is not one of those conditions that is recurrent. In other words, if your child has sepsis, it is very unlikely for it to happen again. It's not like an allergic kind of condition, for example, where it can happen again. So it is very unlikely unless that child has what we call the child is immunocompromised. In other words, there are some children that for one reason or the other, their immune system is suppressed. They have immunosuppressive illness, like children who have HIV, for example, HIV AIDS. They have to have it with the AIDS, or children who have severe malnutrition. So children who are already immunocompromised, those are the ones that are at risk of having sepsis over and over again. But otherwise, healthy children should not be having sepsis recurrently. All right, so we don't expect it to be happening again. So it is the same general principles of prevention that you will use. All right, the same hand washing, the same making sure the children are immunized, the same general principle of hygiene, personal hygiene, environmental hygiene is still the same principle. So it is very unlikely for children to keep on having sepsis over and over again as long as they are not immunocompromised. Sometimes if a child starts having sepsis over and over again, so one of the things we suspect is there an immunosuppressive illness. In fact, sometimes that's our first time of picking up children who are developing cancers or tumors, because one of the things we notice in such children is that they tend to come down with infections quite often, and then that may be our first inkling to the fact that, oh, this child may actually have a cancer or an immunosuppressive illness going on in them. So otherwise, if your child has had sepsis, if you maintain the general principle of hygiene and all that, we don't expect it to keep on happening again. All right, I hope that's helpful. All right, I got another question still from that same person. He says, is there anything that can purify the blood so that the germs can disappear entirely? All right, so I know there's a lot of myths and belief system, especially in Nigeria and Africa, about purifying blood and all that. So I'm going to speak to that a bit. Number one, when your child has sepsis and we treat the sepsis, the work of the antibiotics is to kill, let me put this in that in that layman's term, all the bacteria of the germs. Okay, so the antibiotics get rid of them. So by the time we finish treating your child with antibiotics, all those germs should have left the baby's or the child's blood system. So there should be none anymore. And usually we repeat our blood tests, we repeat our football count, we repeat some of those what we call markers, infection markers that we when we started treating, these were the markers that were very high that told us that something is going on, infection is going on, sepsis is going on. So when we finish treating, we do the test again, the markers are low, and then we know that we have cleared the infection. So once we've cleared the infection, once we've treated the child, and the infection would have cleared. So you don't need to give anything to clear the blood, all right? Okay, there's nothing like purifying blood. Okay, a lot of people believe in all this detoxification, you need to purify the blood and all that. All those are myths. They are old wives' fables and stories. Okay, so please don't go and be giving children about drugs or some so-called supplements or whatever because you want to purify blood. There is nothing to purify. Okay, if a child is having infection, that is the time there are germs in the blood, and that is the time they need to go to the hospital. That is the time for the doctors to treat them. Immediately we finish treating them, the germs are gone, all right? So they are no longer in the blood, because the sign that they are gone is that the child will be better, the child is recovered fully, and there are no more fever, no more symptoms of sepsis, they're fine, and then we know we have won the battle, all right? So there's no need for you to go and give anything, so-called blood purifier or whatever other jargons they call it. So there's no need for you to do all that. So don't go believe people that say you should give your children something to purify the blood and all that. All those things are not true. You don't need to give them anything to purify their blood. And there's no need to give, some people say, oh, I need to give blood tonic because the antibiotics has dry up the child's blood. That is not true. Antibiotics does not dry up the blood. What antibiotics do, what they do is to kill the germs and take away the germs. Okay, just to say that what sometimes can happen is that when a child has infection going on, some of those bacteria or germs, they actually attack the red blood cells. They attack white, they go into and they cause a lot of breakdown. So they can cause the red blood cell to break down. So it is possible in some infections, not all infections, for the blood level to go down. So it is not the antibiotics that is drying up the blood. People also say it even for adults. Antibiotics do not dry up any blood, but the infection process itself, as part of what it does, as part of the the bad things that the germs do in the body, they can break down the red blood cells, and then the process of breaking down the red blood cells, the blood level of the child comes down. So it is not the antibiotics doing that; it is the germs doing that. So what we normally do is that we treat the germs with the antibiotics. Then, if the blood level has dropped because of the infection and everything, we give the children the blood tonic. Usually, we tend to do it afterward because some infections, if you give the blood tonic while you are treating it, the bacteria too will be feeding on the blood tonic as well and getting more powerful. So we try to avoid giving iron, in some instances, except it varies, but most of the time we try to avoid, so that we treat the infection first and then we give the blood tonic. So that is what is happening there. All right, I'll take the last question I have on sepsis, still from the same source. It says, does sepsis have age limits? Okay, the answer to that is no. Anybody can have sepsis. It can affect adults, it can affect children. Already I've talked about the fact that some children are more at risk, compared to others. Our preterm babies are more at risk. Our newborn babies, higher risk. Children who already have other illnesses and infections, immunocompromised status, maybe they have HIV, they have severe malnutrition. Those are the people that are more at risk of sepsis. But any child can have sepsis. And this person is asking that when the child gets to such an age, will it stop? Sepsis is not something we expect to be recurrent. I guess that boils down to the first question the person asks. So sepsis is not something that should be recurrent. So it's not like an allergy that you outgrow. We don't expect children to really be having. So we don't even expect them to have it at all. And when they have one or so, when we are very aggressive in treating, we don't expect it to keep coming back again, unless the child has immunosuppressive illness. Even then, we deal with that immunosuppressive illness itself so that the child doesn't have sepsis. So if it is HIV, we treat the HIV, we give antiretroviral drug. If it is severe malnutrition, we deal with the malnutrition quickly. So they should not be having sepsis recurrently. So it is not something they should outgrow. It is not something that you get to a certain age, you stop. We tend to use those kind of terminologies for allergic condition, which is genetic, which is inborn with the child. But sepsis is something external. This is a germ coming into the child's body and the body responding to it in an excessive way. So it is not something, it is an abnormality. It's not something that should be happening. But if it happens, it's something that we need to deal with it. And your child does not keep living with sepsis, okay? Sepsis is a condition you treat and you cure it, and that is the end, okay? It is not those conditions that is genetic or that the child lives with all their life, like allergic condition I've mentioned earlier. It's something you treat. The child is better. The child is not expected to have sepsis again. All right. Of course, it can happen again, but we don't expect it. If you do take note of all our prevention techniques, it should not happen again. All right, I think I'm going to stop at this juncture. Thank you so much for everyone who have listened. I hope you've learned one thing or the other. If you still have questions about sepsis, feel free to go to our Facebook group, and then you can ask your questions there and we will try and answer them. The most important thing is we should prevent sepsis, okay? Remember hygiene, remember immunization, and act quickly, okay? If there's one thing I want you to take home today, is act quickly. If the child is sick, fever, tired, sleeping too much, any symptoms you are not sure, please don't self-medicate, don't self-diagnose. Take that child to the hospital as soon as possible and let the doctors treat them. The earlier we see a child who has sepsis, the better, and the more likely the child is going to recover. So thank you so much, everyone, for watching. I'll see you again next week discussing another important topic. Till then, it is bye from me. Bye.
Are you a mother, father, or you are involved in caring for children? If yes, then listen to Ask the Pediatricians every Thursday by 10 a.m. for insightful discussion on popular child health topics such as dangerous child health practices, immunization, infant feeding, developmental milestones, and so much more. You also get to ask questions on these topics and listen to answers to real-life child health issues by a pediatrician. Ask the Pediatricians Foundation is devoted to health education and information of parents and caregivers of children in the community to support you in raising healthy children. Don't miss Ask the Pediatricians with Dr. Gbemi because it's informative, educative, and interactive. Ask the Pediatricians Hour, the program for caring parents.